Good evening, everyone, and thank you for joining us tonight. My name is Alicia Gabidon, and I am an adult services librarian with Vaughan Public Libraries. Before we begin the formal program, I would like to share a few housekeeping notes. To minimize interruptions, participants will be set to mute and videos will be turned off. For accessibility, we have turned on the live transcript feature. A question and answer period will follow the lecture. Questions can be sent in at any time during the lecture via the chat function and are moderated by the co-hosts. Tonight's lecture is being recorded and will be made available on VPL's YouTube channel. So now I will pass it on to my co-host, Donnelly Smith, who will do the land acknowledgement.
Welcome. Thank you all for coming tonight. On behalf of Vaughan Public Libraries, I would like to respectfully acknowledge that our libraries were built upon the territory and treaty lands of the Mississaugas of the Credit First Nation per the Toronto Purchase Agreement or Treaty 13. We also recognize we are situated in the traditional territory of the Huron-Wendat and the Haudenosaunee who occupied this land before the arrival of European settlers. The city of Vaughan is currently home to many First Nations, Inuit, and Métis people. We acknowledge their contributions to the life and prosperity of this land. As representatives of the people of the city of Vaughan, we are grateful to have the opportunity to work and live in this territory. Thank you.
So I am pleased to welcome this evening Dr. Alex Mihalides, Scientific Director of Agewell Network of Centers of Excellence and PhD lecturer at the University of Toronto. He is an internationally recognized researcher in the field of technology and aging and is very active in the rehabilitation engineering profession. Please join me in giving him a very warm welcome.
Well, thank you very much, Alicia, and thank you everyone for taking time out of your Thursday evening to come listen to my talk. And what I'm going to do now is I'm going to share my screen. Hopefully everyone can see that. I'll take silence as a yes. So again, welcome everyone to my presentation tonight called The Role of Technology to Support Older Adults. As Alicia said, my name is Alex Mihalides and I've been a professor at the University of Toronto for the past 18 years now, looking at the area of how technology can support older adults and their family caregivers as well in order to remain as independent and as healthy and well as possible within their own homes and communities. In my presentation today, I'm going to talk not just about home care, but I'm also going to touch upon other aspects of care within the community, including long-term care. And as you can imagine, this is, I think, necessary at this stage based on everything that we've seen happen throughout the pandemic with long-term care as well. So what I'm going to do is I'm going to start off with a little background information just to really introduce the topic on why we're looking at technology to support older adults. And then I'm going to give you some examples of technologies that are currently being developed and that are currently coming on the marketplace here in Canada. And then we'll finish off by talking a little bit about where the field needs to go. And then as Alicia said, we'll have some a Q&A after my presentation. So feel free to start putting any questions you may have during the presentation in the chat window there. So let's start off with this map. And what this map shows is the percentage of population that will be over the age of 65 by the year 2050. And as you can imagine, anything in red is a high percentage of people, of the population that will be older than 65. And the one thing you'll notice here is we see all the typical countries that we always hear about as being super aged, as they say, and that includes Japan and other parts of Asia. But you'll see that Canada is in there as well. And in fact, Canada is the only country in North America that will be considered one of these super aged countries. So this issue of having a high percentage of our population be over the age of 65 is not something that's far away from us. In fact, there's actually new projections and models that show that we will be considered a super aged country by the year 2030. And so the question is, well, what does this mean? You know, what does it mean to be considered a super aged country, and what are some of the potential issues that may arise? And they're all things that we probably all know, we've heard about many times in the media and the newspapers, et cetera. And then that really comes down to providing support and care for these individuals. Because in Canada, we're starting to see two trends that are starting to become a bit worrisome when it comes to providing proper healthcare. And that is, as I just mentioned, the increasing number of older people. That includes the increasing number of older people with various types of disabilities and impairments, such as dementia or Alzheimer's disease. But to conflate that is the decreasing number of people in Canada who are available to provide care, and that is specifically family caregivers. In Canada, like around the world, we're seeing a change in the family unit, in the way that we're seeing people who are younger becoming caregivers to their parents, for example. And when I say younger, this includes people in their early 20s in some cases. And we're also seeing a split within the family unit as well. And as many of you probably know, or may even experience yourselves, it is not uncommon to have the adult children living in Vancouver trying to provide care and coordinate care for their elderly parents who are living in Toronto. So as you can imagine, this is all becoming quite an issue that we're looking at. And as I'll talk about in a minute, hopefully there's some solutions that are on the immediate horizon that can help us to overcome some of these problems. Now, while saying that, one thing that we believe is that everyone can age well, and everyone can age well even in the face of disease, impairment, and disability. And the question is, well, what does it mean to age well? And our definition, or our working definition of that, is having the ability to still do what you want to do, having the ability to still participate in society, and still being able to be connected to your loved ones, your family, your friends, your acquaintances, etc. And in terms of being able to age well and still being able to do these, even in the face of something like Alzheimer's disease, obviously it's going to take various types of interventions to make that happen. Now, as you can imagine, in my presentation, I'm going to be talking about technology as one of those interventions. But before we get there, obviously, we need to talk about COVID-19, the pandemic, because this has thrown a very, very large wrench into the healthcare of older people and the supports for family caregivers. Because obviously, COVID-19 has had a very, very dramatic impact on the older adult population. And that can be anywhere across these 6 different dimensions that the UN Working Group on Aging has developed during the pandemic. And the important ones are here is that it's just not about physical health that the pandemic has had an impact on, but it has had a significant impact on mental health as well. And because of this, we are now starting to see an acceleration of interventions to be used, not just for physical impairments, not just for cognitive impairments, but for day-to-day mental health as well. And while we've seen some very obviously negative outcomes from the pandemic, if we can pull any kind of silver lining out of it, is one, the recognition of the importance of mental health, the importance of social connectedness, and therefore the importance of solutions to support that as well. Now, again, as I mentioned before, the majority of my work has really focused on home care. However, the past 2.5 years has also shined such a bright light on the crisis in long-term care in our country that I really had no option but to look at the application of technologies and different interventions in long-term care as well. Again, we've all seen this in the news. We've probably all gone through our own horror stories where the pandemic has exposed significant gaps in the quality and safety of care within our long-term care homes. In fact, the Canadian Institute for Health Information has reported that over 80% of Canada's known COVID-19 deaths were in long-term care homes. And that's nearly the double of other OECD countries around the world. And the fact that Canada has done such a poor job in responding to long-term care, again, has just really shown that we need to be focusing on long-term care as well in the research that we're doing in my own personal lab, but in the Agewell network as well. So that brings me to the role of technology. And over my 18+ years of doing work in this area and the growth that we've seen in the work that's being completed in the area of technology for older adults, there is now very strong evidence that can show that technology can be one of these interventions. Now, I say one of these interventions because we never expect, or nor should we ever expect, technology to be a replacement for interventions that already exist, and that is the role of family caregivers, of paid caregivers, of staff in long-term care, of our family doctors, of our healthcare teams, etc. But technology can be one additional tool that we can all be using in order to provide even better care, whether it's in our own homes and communities or long-term care. Now, I put this graph together actually for my own interest, but I thought I would include it in this presentation because what this shows is the number of research papers that have been published on the topic of technology and aging over the past 22 years here. And you can see around the time when I started back, in the early 2000s, there weren't very many papers being published, around 200 per year. But as you can see, it's kind of grown very, very quickly. But because of the pandemic, we've seen this significant spike where in the year 2021, there was 6,000 papers published around the role of technology and aging. And if I included the keyword COVID in there, this number actually went up close to 10,000 papers. So again, if we can take anything positive out of the past 2.5 years, is the growing interest by the research community and the clinical community in the role that technology can play, again, as one tool in the support of our older adults and their families and caregivers. So I don't need to tell you that the opportunity for technology, or what we call HTech, and I'll talk about HTech in a moment, is really, really big. And again, I don't need to go into depth about this. The demographics or the statistics, such as the one on this slide, shows that there is a growing senior demographic and therefore a growing marketplace for the use of technologies. It is expected that spending in the HTech sector is expected to surpass $2 trillion globally over the next decade, making this one of the largest industries out there when you compare it to other things such as automotive, consumer electronics, etc. In fact, the opportunity here for technology to support older adults is so big right now that we're seeing mainstream companies like Amazon and Best Buy getting into the area of HTech, acquiring organizations that develop these types of technologies, and working very closely with universities and labs like myself in order to help develop better and more effective technologies to support our older adult demographic. So the word HTech, what does this mean? What do we mean by HTech and what is included in this? And really at the end of the day, it's a very broad term. It's any type of technology that improves the lives of aging adults. And this includes even things like what's called fintech. So that is technologies that help you do your financial work, such as banking, online banking, automated tellers, etc. And it has become an emerging subset of the health tech sector, again, with a specific focus on older adults. And in fact, again, when you compare it to other aspects of the health tech sector, whether that's cardiac devices, health monitoring technologies, etc., it is becoming one of the largest and fastest growing ones as well. And really the quote here by Tina Woods, who's a columnist for Forbes magazine, I think really nicely sums up what HTech is. And it's the preferred way to describe the intersection between longevity and technology. So who then uses HTech? And you know, in my presentation so far, I've really been referring to older people and their caregivers, but we're seeing the consumers of HTech and the consumers of even the research out of labs like myself and others around the world being much broader than that. And when we analyze the current marketplace, which is still relatively small in Canada, but again, growing very quickly, we're seeing that these technologies are not being prescribed by your doctors. They're not being prescribed by your occupational therapist or your physical therapist. But in fact, they're being purchased by older people themselves and by their families and caregivers. And so in fact, and I'll talk a little bit about this later on in my presentation, we're actually starting to see a shift in this area where these types of technologies are actually becoming more like consumer products that anyone wants to go buy at your local big box store or Home Depot or whatever it may be, as opposed to more traditional healthcare technologies, which still require to go through your family physician or your other healthcare provider. So let me tell you quickly a little about Agewell. So Agewell was set up and funded by our federal government back in 2015, essentially to help grow the marketplace for age tech, but more importantly, to grow the pipeline of new technologies that are coming into the marketplace itself. And that is funding research and development across our Canadian universities and colleges and research centers. So Agewell right now is a network of over 1,000 researchers and students. It has 43 different universities, colleges, and research institutes part of it. And it has over 450 corporate, industry, not-for-profit, and government partners. But most importantly, it has over 5,000 actively engaged seniors and caregivers in it. And that is because Agewell has taken the stance that in order to develop a technology or a product that's actually going to make a difference in the lives of older people and their caregivers, it must be designed by older adults and their caregivers. And so that doesn't mean we're just handing things over to older people and say, go ahead and build this. But what this does mean is we are including older people and caregivers as equal and active members of our research teams and development teams, and also as part of our startup companies and our other corporate approaches as well. Now, one thing the government asked Agewell to do was to define, well, what are the areas that Canadian seniors find the most challenging to grow old in, but can see the role of technology playing a significant role. So about 4 years ago now, I would say, we went out and we surveyed over 2,000 older people across the country through online surveys, but also in person as well. I basically went on a bit of a roadshow from coast to coast to coast and met and spoke with older people. And out of all that consultation, we came up with the 8 challenge areas that are before you here. And as you can see, these range anywhere from supportive homes and communities to autonomy and independence, and also financial wellness and employment, which to me actually was a bit of a surprise that this one came out, because there has been very little research done around the role that technology should play to support older people in their financial wellness and employment. But again, because of the pandemic, because of the work that our network is doing, and because of the input of older people, we're now starting to see people do a lot more research in that area. Now, I want to show this slide here because this gives you a very quick overview of Canada's current HTech startup map. And this is mapped out by those challenge areas. And as you can see, this is only over the past 8 years that we've had 40 plus startups that have basically come out of research labs from across the country with funding and support from the Agewell network and from the federal, provincial, and territorial governments, and obviously private investment, that have started to put products out there now on the marketplace that are available across these different challenge areas. So from that, what I want to do now is just give you a quick overview of some of the solutions that are actually now available to you across the various care continuum that I described, and that is from active living right to long-term care. And again, I'd love to show you a lot more of different technologies and products that are available, but obviously we only have limited time tonight. But if you are interested, again, you'll have my contact information at the end. And more importantly, you'll have the contact information for the Agewell network, which is really here and set up to assist you in identifying these various products and how you can get your hands on them. So we're seeing products now in the marketplace for seniors, such as the Vital Tracer. So this is a simple watch. It's not an Apple Watch or anything like that. It's a simple device that has a limited number of functions that were essentially identified by seniors and caregivers as the most important ones they need to have in order to track their vital signs. Now, more importantly, what the Vital Tracer also does, though, is it tries to predict changes in your health before that actually even occurs. And as you can imagine, this is really, really important because this type of technology can allow you to be proactive in ensuring your health and wellness and going out and getting an intervention, whether it's pharmaceutical or non-pharmaceutical or a technology such as HTech or something else, before something a lot worse happens. In the area of independent living, there's a company called Braze Mobility that is looking at making every wheelchair out there a smart wheelchair. When we talk to a lot of seniors who are put into powered wheelchairs, scooters, and even manual wheelchairs, one of the biggest issues they have in that they state is driving them safely. They're worried about running into walls, they're worried about running into furniture, and probably most importantly, they're worried about running into other people. So Braze Mobility has developed a simple kit of sensors that you can place or have someone place on your wheelchair or on your scooter that essentially then acts as the smart sensors, for example, that you have in your car that will beep at you or even vibrate on a special device that you wear on your clothing if you are getting too close to a different object. And based on that information, it will then stop the device as well if you're becoming or getting yourself into a situation where something may be unsafe. And again, this is a product that's just about $300, and that again that's currently available for any of you using mobility devices. In the assisted living situation, and this can also work in your own homes as well, there's a company called Novalte. Now, Novalte, what they have done is they've developed a series of smart home devices and sensors that are easily interconnected, can communicate with other devices that you may use off the shelf, whether that is your hearing aid, whether that's your powered wheelchair, whether that's another type of technology that you're using that monitors your health. And again, easily interconnects then with all the devices in your home as well. Again, so helping you to automatically control your appliances, your lights, your thermostat, etc., but also including a call for help feature as well if something is happening. And I think Novolte is also working on some automated fall detection systems and other types of technologies as well that can call for help automatically if you find yourself in a bit of a tight spot. Now, moving more into institutional care, within continuing care, and again, this can also work in your home. There is a company out there that's actually being started by a group of students from the University of Alberta called the Virtual Gym. And this is, again, it's computer-based, it's game-based exercise and rehab therapy for seniors. Now, this is not the same thing of you going out and buying something on a sophisticated gaming device or wearing a set of virtual reality goggles that are currently out there now. But again, this is an interface and exercises designed by older adults and caregivers for older adults and caregivers as well. And of course, with the input from occupational and physical therapists as well. Now, the nice thing about the virtual gym is it is monitored data as well. So the system can let your therapist or your caregiver or whoever it may be know how well you're doing, whether you're doing the exercises, or if something needs to be adapted or changed because perhaps maybe you've strained your shoulder a little bit, or you got a bit of tennis elbow or something, and therefore your exercises need to be changed as well. Now, if we look at home care, this is an interesting project. It's the Rosa robot, and this is a service robot for use in the home that does things exactly like shown in this picture. It'll help to carry the laundry basket around the home. It'll help to deliver meal trays, or essentially anything that's required to be moved around your home that may be too heavy or too difficult for all of us to do. And that, again, just not for older people. That's for pretty much everyone in the home who has difficulty with some mobility or strength or grip or flexibility as well. So here's an example of how things like robots that we thought are very futuristic and far from the future actually are products that are coming onto the marketplace right now. The final product here is for long-term care, and this is the Alta platform. And this is really meant more for the safety of seniors, but also for the safety of the care staff as well. And this is addressing the issue of transferring older people or other types of patients as well, but they designed it for older adults in long-term care, from their beds to perhaps maybe a stretcher or another bed that's required to take the person to conduct some procedures or something else, or even to transfer to a chair of some kind to put the person to a seated position. And this particular product does that in a way that reduces friction on the person through some automated systems that are built into the bed that you see here, that essentially reduces the potential for things like pressure ulcers or wounds being developed on older people, as we often see in long-term care. But then again, saving the staff from back injuries and other potential injuries that may occur. And in fact, and whenever I say this stat, it even amazes me that nurses have the greatest percentage of back injuries in the country. And that's even compared to construction workers, people who work in mines, in other kind of environments where we expect to see a lot of injuries. So technologies that can help support our staff and our clinical staff is very important as well. So what I've done there is I've shown you some technologies that are pretty much on the marketplace, if not coming on the marketplace. But being an engineer and a tinkerer myself, I always want to show you some cool stuff as well. Not that the other stuff's not cool, it is, but I want to show you some futuristic technologies that we're working on as well. And so what I want to do here is actually show you some videos. And this first video is technology that we're working on that allows your physiological data, such as your ECG, as you see here, to be collected by the furniture and the devices that you interact with. So what you're going to see here is this particular grad student of mine was sitting on the sofa, and a live ECG, and therefore his heart rate and his blood pressure and even respiration rate, was being collected by these two simple pieces of copper tape that was stuck onto this particular pillow. Now, obviously, there's a lot of electronics and guts behind this and a lot of software that we developed. But again, this is an example of how we are looking at homes of the future, where if you can imagine, just by simply getting up in the morning, going through your typical bathroom routine, going into your kitchen and having your breakfast, and then going about your business, we're now collecting your heart rate, your respiration rate, your blood pressure, your walking speed and other indicators that over the day and over the week, we can start looking at trends in that information. And based on those trends, we can again start to predict who may be at risk of perhaps their congestive heart failure getting worse, perhaps being at risk of having a heart attack, perhaps being at risk of falling, or even developing Alzheimer's disease. And in fact, we do have a project where just looking at your simple motion data, so how you move around in your home, with about 90% confidence, we can predict who may develop dementia over the next 3 months. So you can imagine how powerful these types of tools may be, not for diagnosing these things, but again, as a tool in the toolbox that your family caregivers or your healthcare circle is using in order to provide the best interventions possible to our older adults. Now, there we go. Let me show you this particular video now. Now, this is a robot called Pepper. Pepper is available off the shelf, and one that we use in our research. And we're using Pepper here to help in the diagnosis now of dementia and Alzheimer's disease. And what you see on the left-hand side here is a common tool that is used to assess memory and cognition, where what the therapist or the clinician does is asks the older person, or anyone for that matter, to describe what they see in this picture. And then based on what they described and how they describe it, the clinician will make an assessment of your cognitive ability. Now, as you can imagine, that can be very subjective, right? So one clinician may translate that or interpret those findings very different than another clinician. So what we've done is we've automated this using Pepper the robot. And so by doing this, using a robot and using artificial intelligence and other speech recognition technologies that have been developed in this area, this type of test can be now done in a very consistent manner, because what robots are good at doing is doing the same thing over and over and over again, and complete a repeated tasks that become very fatiguing and difficult for humans to do on its own. So I'll play the video here and you'll see it. This is actually being done with an older person. And we'll just run it.
Today I will be guiding you through a simple test to screen for dementia. In a few moments, I will show you a picture on my tablet. All you need to do is describe what you see. Let's get started.
Doing the dishes. And he's into the cookie jar for his sister. And she let the water run over in the sink.
Great job. Thanks for doing this together with me. That was a lot of fun. While we wait, let me tell you more about this test. Just now I showed you a picture on my tablet and asked you to describe it to me. Your response can tell us more about how you express what you see. Sometimes we can use these results to screen if someone may be at risk of developing dementia. Remember, the results of this test are only for screening, so you will have to see your doctor for more accurate results. Thank you for your patience. Your results show some differences between other healthy participants. Since this is only a screening, it might be a good idea to speak with your doctor for more accurate results.
Okay, so again, what you saw there, again, this is very much research-based. You'll, even notice there's still a power cord that Pepper needs plugged in right now, so it doesn't make it that much of a functional device in a real-life setting. But you can imagine where this could be going, right? So you can imagine maybe not in your homes, but in your doctor's offices or in the memory clinics, that these types of devices can be used to collect this preliminary information from the older people who are going there or other types of patients who are going there, and can really help to make this type of practice more effective and more efficient. And again, really help us to be able to observe and collect information from more people than we possibly can right now under our current system. Nope. Stop, Pepper. Okay, so I'm going to move into the final part of my presentation. That is, what has to now happen in the age tech sector in Canada for anything I've talked about here to be useful. And unfortunately, right now, a lot of the technologies that are being developed are stuck in this dry desert, deathly looking place, which I use to represent universities and research labs. And what needs to happen is the current landscape needs to change, and we need to move over to this grassy, nice, flowery, beautiful place, which is the actual real world, in order for these innovations really to make it to the marketplace. Because if things don't change in the way that we're doing things with respect to research in Canada and around the world, many of the technologies that can be useful will remain over here in the research labs and not make it over here into the hands of the people who actually need them. That is the older adults, the caregivers, the clinicians themselves. So the question is, how do we do that? And one model that we are preaching here in Canada now is, for any technology or age tech product to be successful, there really needs to be three parts that need to be considered. That is the technology, the service delivery model, and then also the policy and practice that goes along with it. And the most successful solutions will be right here in the middle. This is the sweet spot that we need to aim for, because again, I can build you a cool robot like Pepper that I showed you, and therefore get the technology happening. But if I don't understand how I'm actually going to deliver that robot into your home and make it work for you, and if I don't understand if I have to work with Health Canada or I need to change some policies or practices in order for that robot to be used to assess your cognition, then again, that robot's just going to sit in my research lab and collect dust. And and I'm guilty of this as well. You can come to my research lab here in Toronto, and you'll see a wide range of technologies that just really never made it because we did not consider these three factors. So moving forward, the technology piece is going well. Canada is seen now as a world leader in the development of age tech solutions from a technology perspective. So really where we need to focus now is the service and the policy and practice. And this is where Canada is lagging behind the rest of the world. So first, in terms of the service delivery models, Canada needs to recognize that the majority of the technologies I have been describing to you are not medical devices, right? Remember I said before, and I had that slide up before that showed, well, who are buying these age tech solutions? And I said that they are becoming more and more consumer products. And that's exactly what we are seeing. And that is what we're hearing from the older adults and caregivers that we talk to, who say, again, it's so difficult to get my hands on these technologies and these solutions. I apologize if you can hear my dog barking in the background. That why can I not just go to the Home Depot and buy these solutions and install them myself in my own home or in the home of my parents or my loved ones, etc. So that is something that needs to change in Canada. We have not embraced that, and that is something we are working hard with our policymakers to help to understand and how to move that forward. More importantly, though, there's this grassroots movement that we're also seeing where consumers, for example, family caregivers, are building their own solutions. You know, as caregivers become younger, they are more tech savvy, and they're more willing to go to the hardware store or the electronics store and pick up the pieces they need to build their own solutions. And I've seen this. I know caregivers who have built their own fall detection systems that work just as well as the technologies that I've been trying to build in my lab, but they're actually being used in real life because they built a solution custom to their father, their mother, their whoever it may be that they're providing care for. And so this is a movement within Canada that is growing, but that again, that we as an industry, whether research development or actually those in the marketplace or the policymakers, need to start to support as well. And so again, here's an example with Best Buy. In the United States, Best Buy now has a smart home solution called Assured Living. And in fact, what they've done is they've actually trained their Geek Squad members. So those are the individuals who will come to your house and set up your television or your stereo system to actually go and assess an older adult's homes in terms of what they may need, and then come install and support the smart home system. And again, help the family caregivers to work with them in order to understand what kind of information is required to, again, provide quote unquote assured living. Now, in terms of the policy piece, one thing that's happening now in Canada is the development of standards to help make our long-term care homes safer in order to provide better care to the residents as well. And I wanted to include this in this presentation because this is another hat that I'm wearing. That is, I am chairing the technical subcommittee for the Canadian Standards Association, or the CSA group, in the development of standards to support the safety of older adults and residents in long-term care, including their staff, visitors, and family. And technically, this standard is known as CSA Z8004, the operation in infection prevention and control of long-term care homes. So I just wanted to spend a couple minutes giving you an overview of the standard, and you'll see why in a moment why I wanted to bring this up today to this audience. So in terms of this new long-term standard that's being developed, and this is being developed in conjunction with the second standard, which focuses more on the type of care that should be provided, and that's being developed by an organization called HSO, or Healthcare Standards Organization. This standard will take in consideration the operation and the design of long-term care homes in order to allow its residents and its staff to go through normal day-to-day activities, but also to be able to be more proactive and prepared for any future catastrophic events that may occur, whether that's another outbreak, God forbid, common epidemics like the flu, or other types of events that may occur in the home. Now, the end user of this standard is very wide. Typically, a CSA standard, and for those of you who don't know or are familiar with the CSA group, you know, if you pick up your bike helmet or any ice skating helmet, you're going to see the CSA logo on the back of it. And that's because CSA has developed thousands of standards to cover off various products, whether, again, it's a consumer product like your ice skating helmet to electrical fixtures, etc. And typically the users of these standards are the engineers, the architects, etc. But this standard is special because we realize that long-term care is such an important aspect of our society and the care of our older adults that obviously residents and families also have a great interest in this standard. And therefore we wrote this standard not only to be readable by the engineers and the architects, but also by the directors of care by the operational staff, by the care staff themselves, and most importantly, by the residents, that is the older adults and their families. So I'm just going to give a very high level overview here of what's in the standard and point out some key aspects around it. But the first thing I want to mention is we went into this standard by having a people-centered care approach. We wanted the residents and the older adults themselves to be at the center of anything that we wrote, and not to have this poor balancing act of people's autonomy and dignity and access to personalized bedrooms and socialization. And none of those things be impacted by the things that the home needs to have operationally to ensure their safety and their health and wellness. And we never saw this as one or the other, but that we saw that we can have both of these things within our standard. And so the standard is organized into sections, or what we call clauses, and then subclauses beneath each one. The most important clauses, I would say, in this standard, and which really sets this standard apart, is first of all, clause number 4, which talks about commitments that we want every long-term care organization to take into account and really to take seriously. And that includes things like equity, diversity, and inclusion. It includes differences in culture and cultural practices, and even drills down to things like sexuality and sexual preference and choice of the residents themselves. Another important aspect of this standard, obviously, is clause number 7, and that's really the heart of it, around infection prevention and control. Clause 8, again, is something that's unique to a CSA standard, and that is, we talk about the design of the homes as well, right down to the furniture that should be there, the finishings, the design of hallways and walkways to ensure the safety of residents, and also things around the design of residence rooms. The final important piece here is clause number 10, and that's why this kind of ties back to my presentation, that we know that technology, like the ones I've shown you, are going to start to play a larger role in long-term care homes as well. And hopefully, again, being one tool to reduce some of the horrific things that we saw during the pandemic, such as social isolation, which actually became one of the #1 killers of residents in long-term care. The lack of socialization, mental health, depression, etc. So we've actually included a clause in here that talks about how technology can be used and what these homes need to have built into them to support, whether it's a simple technology, like handrails or walkers, to more complex ones, such as the Braze mobility device I showed you for the powered wheelchairs, to the futuristic ones like the use of robotics. Now, I've included this not just to give information that this standard is being developed, but also a bit selfishly as well. This standard that I'm chairing is now out for public review, and the public review ends April 11th. And what I'm asking for all of you, and I'll try to put these links into the chat window as well, is if you're interested in seeing what's in this standard and providing comment on it, please go to the links that are provided here. There's a very simple one-time registration that's required, which I know is a bit of a pain in the butt to do for everyone, but is part of the process. But that'll then give you access to the standard and the ability to provide comments on it on any sections that you wish. So you don't need to read the whole thing. It is quite a long document, but you can look at the parts of the document that you feel are most relevant to yourself or to your family members, etc. So again, I'll try to make sure we get these links out to you in the chat. So to finish off, hopefully I've convinced you all that the time is now. And one of the guilty things we have in research is that we're always very incremental. We like to build upon small successes that we have. And it's no wonder that it was found that from time of start of a project to the point where my research can have an impact on your lives takes an average of 18 years. And that is no longer acceptable in this era. We cannot wait 18 years for new solutions to get out there to support our older adults and caregivers, whether it's in your own homes and communities or whether in long-term care. We need to be disruptive in this area. We need to start doing things differently. Again, around the technology development, around the service delivery, around the practice and policy as described. And again, it's those last two things that are the really important aspects. And you know, my engineering students hate when I say this, but the technology part is easy, right? Like we can build you a better robot, we can build you a faster piece of software or a better app, but it really does come down to getting these things out of the research labs and into your hands. That's the hard part. And because of that, we need to reconsider the traditional ways we've done things, right from the research to the government level and everything in between. So before I sign off here and open the Q&A, I just want to really pose this question. I want you to imagine what you think the future will be in the area of HTech and technologies for older adults. Will it include robots who are providing assistance to the clinicians? Will it be robots directly in your home providing support to you and your loved ones? And this is an image from the movie called Robot and Frank, which if you haven't seen, I highly suggest you take a view of. Will it be robots actually physically providing care to people in hospitals, in clinics, in your homes? Will long-term care homes and your own homes just become a network of sensors that's collecting information from everything that you do, right from when you're getting up to what you're eating, the nutritional value of your meals, how much exercise you're getting, your heart rate, your blood pressure, etc. And will at the end of the day, will clinicians and your family doctors and even your family caregivers just become essentially data scientists who are receiving information from all these sensors that are built into our worlds and are just responding to key indicators that are being that are alerting them to based on things such as artificial intelligence and other types of smart algorithms that are all being developed right now. And again, will this just become one of the bigger tools in the interventions that we are providing in order to reduce those issues that I spoke about at the beginning of my presentation around the increasing number of older people and the decreasing number of people who can take care of them, and also in terms of helping all of us to remain in our own homes and communities for as long as possible. With that, again, I thank you for taking your evening to listen to this. Here is my contact information. Here's the Agewell website, and on the front page, there's a button that you can click to get in contact with us. But again, feel free to email me, follow me on Twitter if social media is one of your things. But I'm always happy to chat with people and to see how we can get involved. And with that, again, thank you very much. I will stop sharing my screen. And while we get into Q&A, I'm going to get those links into the chat as well. And with that, I think I hand it back to Alicia.
Thank you. Thank you very much for your excellent presentation and for sharing your extensive knowledge and insights with us. We would now like to open the floor to questions. If you have a question for our presenter, please submit it via the chat and we will select a few to share. I see that we have gotten quite a few from before, so maybe I will start with what came in initially. So the first question, curious about what percentage of long-term care communities have a dedicated tech role?
Very, very small, I would say. I still go into long-term care homes that do not have Wi-Fi, that do not have internet available for their residents and visitors. And something as simple as being able to connect over, something like FaceTime or Skype during the pandemic, again, just in my own opinion, probably would have made a world of difference in many of the lives of the residents in these homes. So long-term care is very much behind the technology ball, and hence why we are making it part of the standard, but hence also why we work so hard and we work so closely with long-term care home operators, both private and public, to educate them around the role that technology can play. And we are starting to see some early adopters starting to work with us and allow for research to happen within their homes to test new technologies. We have some robots roaming about some long-term care homes. Again, all very much research-based at this time, but we are starting to see a growing interest from this sector now in what we're doing.
Okay, great, thank you. So the second part of that question is, the person is also wondering who is developing apps for having a games night with friends?
Yeah, so those apps already, there are apps that are out there. For life of me, none of them are coming into my mind right now. But there are games out there that you can be getting and downloading onto your tablets, et cetera, that allow you to connect and do friends, game nights, et cetera. I know one that, me and my friends have been using during the pandemic is one that allows you to do trivia and basically hold quiz nights like we used to do in the pubs and the bars. And so there are ones that are out there. Again, I think it's the end of the day for me here. None of them are popping into my mind, but feel free to email me.
Okay, great, thank you. So here's a question from Ontario Hospitals Complex Care. Your subject is extremely interesting. Could you please comment about the use of technology in Ontario Acute Care Hospital, where sick and dying elderly are placed in a longer-term stay in the complex care and palliative care units?
Yeah, sorry, I was reading the rest of the question as well.
Okay, yeah.
Yeah, so again, you're going to find very little technology in acute care settings. The technologies they're using are more about patient care, patient monitoring, as opposed to some of the technologies I've been talking about. But again, you can imagine, so say the technology that I showed you that measured ECG from that young man who was one of my former grad students while just sitting there on the sofa. Imagine during the pandemic if that type of technology existed and built into the beds in acute care settings or in ICUs, so that there had to be less physical contact between the nurses, the doctors, and the patients to collect those vitals, where a lot of times transmission of COVID may have occurred, right? So again, that type of technology could have played a significant role. The problem here as well is that many acute care settings and people work in them, again, do not know the technologies that could be made available to them. This is just not in acute care, but this is in long-term care, in rehab settings, et cetera. And I say this in personal experience. So about 2.5 years ago, I had a severe accident. I ended up being a patient for 4 months in the same hospital where I'm a researcher, which is an interesting, different story. But the nurses that were providing care to me didn't even realize there was a research lab in the basement of that hospital developing technologies that they could be using, right? So this is not the nursing staff's fault. This is our fault as researchers. We've done such a terrible job in educating clinical care staff, whether in acute care, rehab, long-term care, about what can be used. The last part about this is palliative care. Technology has not made its way into palliative care yet. However, is starting to grow. And we are starting to see people looking at how technologies can play a role in palliative care, perhaps not in the care of the individual, but just in the comfort of the individual, and using technology to make sure they remain connected during these times if possible. And then also helping the families and the caregivers also access various resources such as mental health, et cetera, during this time. And I was reading the further part of this comment around the TVs, because I just had to laugh about all the TV trouble I had while being a patient. And eventually just, and the funny thing is, you'd think these days I would just use my iPad to watch television. The Wi-Fi and the internet was so bad in this hospital that as a patient, I couldn't access it. And so I was reliant on these systems because I couldn't use my own devices. Anyway, I digress. I could talk about my experiences for a long time, but let's get back to your questions.
Okay, great. So we will jump to two questions. I think one was probably just a continuation of the other one. As many of these devices require collecting user data, what measures are in place to protect the privacy of the user?
Yeah, that's a great question. So security and privacy is top of mind of all researchers in this area now. And what we've done is we've worked with various agencies such as the Privacy Commission of Ontario. That's not the exact name, but pretty much what it is. And we've developed things such as privacy by design guidelines. So these are principles that everyone who's designed these types of technologies must take into account. Well, not must, they're not enforced legally, but should take into account when they're developing technologies to ensure that we're maintaining the privacy and security of the user. We've been working with other sectors such as the banking sector to understand what they're doing around privacy and security and applying their approach and techniques in this area. So again, it's a topic of such great importance that we are actively ensuring that we are adopting as high of standards as possible to make sure that privacy and security of everyone's data is one of the top design criteria that we follow.
Okay, great, thank you. So the next comment is, though I can appreciate the usefulness of technology to support seniors in various environments, one must not forget that many seniors do not have the funds required to acquire certain technologies. In many cases, I believe many adjustments and adaptations, which are most often no or low cost to increase the safety and independence of individuals directly in their home. Denmark, for instance, sends 63% of their health budget on home and community care, and Canada spends 13%. Interesting comment.
Absolutely. I love questions that also give me data to support the question. You're absolutely right. We have done a very poor job around this whole notion of equity, diversity, and inclusion, particularly on the equity aspect when it comes to cost. It is one of those things now that have really bubbled to the surface that we need to work on and deal with. And towards that end, Agewell as a network has been working very closely with policymakers to ensure that it is known by our policymakers and our government officials that access to digital technology is a basic human right for everyone. It's not a luxury anymore. It should not be a luxury anymore. And this is particularly the case for seniors, for under-resourced areas, for our northern and indigenous communities, and pretty much anyone who requires access to technology but does not have the resources to do that. Now, when you throw health on top of that, it becomes even more of a basic human right that everyone must have access to. We do not want to turn this country into haves and have-not. We do not want to create a multi-tier healthcare system because of the use of technology. And again, that is something that is really based on the policymakers. Now, you notice I say that's an issue of the policymakers and not the tech itself. And that's because the cost of these technologies are coming down so rapidly. 5 years ago, or even 3 years ago, I would have said robots are never going to be in people's homes. They're too expensive. But in the past 3 years, we have seen robots go from hundreds of thousands of dollars to tens of thousands of dollars to thousands of dollars and now to hundreds of dollars. So they are, becoming more affordable every single year, and we're going to continue to see this trend continue. So it really is something that comes down to service delivery models and policy in order to ensure that everyone can have access to all these technologies.
Okay, great, thank you. So maybe you sort of answered this question before, but I'm just going to read it anyway. Can you comment on any groups that lobby the government for the use of accessible technology in Ontario hospitals for elderly patients? Technology that is simple to use for patients with cognitive decline and inexpensive to be used for low-income patients with disability.
Yeah, absolutely. So beyond Agewell, the #1 organization is CanAge, and that's led by Laura Tamlin-Watts, who I think gave a presentation a couple of days ago or sometime close to me. Laura's organization, CanAge, I don't know how they do it, but they get in front of ministers and policymakers, and they make change and difference. So CanAge, I would say, is the #1 organization in Canada right now that's really leading the charge in this particular aspect.
Okay, great. What about building more older adult communities with small homes, that is 2 bedrooms, kitchen and living room, something that is more affordable than a bigger home that isn't needed and more difficult to maintain?
Yeah.
I figure that's like a comment sort of thing.
Well, I think that's a great comment, and these are models that we see in other parts of the world, not just in the communities, but for example, you know, in long-term care settings. So in the Netherlands, they have the dementia villages that are showing, you know, huge impact in terms of quality of care. You know, having you know, these more inexpensive communities for seniors we're seeing around the world. Again, we're not seeing a lot of traction in Canada, and this is where I said before, Canada lags the rest of the world when it comes to policy around this. But these are things that we should be doing and seeing here in Canada and demanding that we see in Canada. You know, just as an analogy, I saw a news story about this, and for the life of me, I can't remember the name of it, but and this is happening in Ontario right now, where they built a community of homes using the large storage containers, right, that we see on ships and stuff, to build, and they converted them into homes, and they're developing them into communities for veterans, right? So that veterans can have access to these houses and access to a community that can support them. And, you know, why are we not doing the same thing with seniors? It's such a simple, elegant solution in my mind that we could be looking at. So again, these are things that we need to be pushing our policymakers on. Okay,
great. So another comment, person would like to follow up on low vision and low hearing together. What are the developments for someone who has that condition?
Yeah, so there's been some advances around low vision, low hearing, particularly in the low hearing, where you're starting to see far more advanced and intelligent hearing aids that use things like artificial intelligence. And so, for example, there are hearing aids out there now that will automatically direct your hearing to the voice that you want to hear. And so if you're in a crowded room or something and you're looking at a person and you're listening to the conversation with them and you have all this background noise, that background noise gets filtered out, so you don't hear it anymore. You're only hearing the voice for the person you're looking at. So we're seeing a lot of advances like that. In terms of vision, you know, we have not seen as much of an advance as we've seen in the hearing world, but again, we are starting to see some things more around assistive technologies for low vision. So screen readers, magnification devices that are far easier to carry with you, cheaper than they used to be before, things like that. In terms of eyewear and stuff, to be honest, I'd have to check with some of my other colleagues who work in those particular fields.
Okay, and this person wanted specific examples of aids that can improve older adults with mobility and accessibility issues, looking for specific devices, if that's possible.
Yeah, so for mobility, again, it depends on the type of mobility issues and the extent of the mobility issues. But you know, there have been advances, obviously, in mobility devices like scooters and powered wheelchairs if needed. Unfortunately, there's been very little advances in the area of walkers. Walkers still very much look the same and operate the same way that they used to 30, 40 years ago. And for some reason, they still all get painted like, you know, that mint green color that you tend to see for a lot of these institutional devices. But, you know, there's other things that are happening as well. So for example, on footwear, right? You know, a lot of mobility issues happen in the winter, in the snow and the ice. And there's a lot of work out of Toronto Rehab that is actually assessing footwear and winter boots, and basically gives them a rating score like you would see for winter tires. And so you can actually go and see on their website, which is, I think it's www.ratemytreads.com. I think I just put in the chat. Oh, sorry, that went to Sandra's iPad directly for some reason. www.ratemytreads.com. I think that's the website. It's not that. If you just Google that, you'll find it. And essentially, you can go on here and you can find which winter boots and footwear tested the best for icy conditions, slushy conditions, etc., to help increase your mobility and safety when walking. There's also been a lot of advances in shoe inserts, for example, that can monitor your balance and give you a little feedback, whether it's through a vibration or a little buzz, if you're starting to lean too much over and that you are now at danger of falling over. So there's that types of technologies that are out there. They're readily available. In addition to the more classic mobility devices like the wheelchairs, the walkers, etc.
Okay, great. And we had some comments about long-term care facilities in terms of standards. The standards are a great idea, but unless they are mandated by the government, you know, one wonders exactly how much implementation there would be at the individual long-term care facilities. So that's an interesting comment.
Yeah, that's a great comment. One that's haunted me for the past 18 months of developing these technologies, the standard. Yeah, they're not mandated by the government. And as we all know, long-term care falls under the purview of the provinces and the territories, not federal government. And so the federal government has very little power right now to tell the provinces to adopt standards. So what we're doing there is really being two things. First of all, we've worked directly with the long-term care home operators in order for them to have significant input and say on these standards. We're not letting them develop the standard because that'd be a conflict of interest, but ensuring that we're taking into account the things they're telling us, right? So for example, we've heard things like, well, you know, I'm a small long-term care home in a rural location. How am I going to implement these things? My home is 30 years old. There's no way I can do renovations. Or I'm building a brand new home. What should I be including? So we've really taken, again, a bottom-up approach on the development of these standards so that these home operators have some kind of skin in the game, so to speak. And if we do that, then hopefully it'll be the industry that will lead by saying, you know what, it just makes sense for us to adopt as much of this standard as possible, and as much as they can do. The second thing we've been doing is we have been including the government at all levels in this process. We actually have a standing table of federal, provincial, and territorial representatives from most of the provinces. Some provinces right away called me up and said, thanks, but no thanks. So we try to keep them involved as much as possible as well, so that they understand the importance of these standards and that they can lobby on our behalf. The final thing I'll say we also try to do is we've never gone into this process with the expectation of us replacing what is currently happening, if it's good practice. So in many places in our standard, if you have the time to read it, you'll see that we sometimes say, we defer to your local building codes, right? Because there are good practices in place across the country that we do not want to supersede. And so because of that, we try to work together for our standards to support and supplement what already exists. And beyond that, it's going to take lobbying on all of our parts, right? And talking with the government. And, you know, we met with the Minister of Seniors a few weeks ago, and we said, well, you know, what is that $3 billion that the federal government said is going to long-term care going to be used for? The minister had no idea, right? And so these are things that we got to continue to push and to see what can happen. It'll be interesting when the budget comes out next week, if there's any further talk about this money for long-term care. We're hoping it's used to incentivize homes directly to implement the standards as much as they can.
Okay, so thank you all for your questions. We will be closing soon. I will take only 2 more questions or comments. There is a question here, I guess it's financial. Would this technology be affordable for older adults on basic pension with annual income below $25,000? And the question after that is, please, can you speak about technology to help people living with dementia?
Yep.
So those are our last 2 questions. Thank you all.
Yep. So to answer that first one, again, my answer is we really hope so, and that's what we're working towards. But again, it has to be a combination of the technologies coming down in price and our policymakers and our governments, et cetera, putting proper programs in place to support the acquisition and the use of technologies by our seniors, no matter what their income level is. To answer the second question, technology for dementia actually is my particular area of research, so I'm happy this question came up. So we're doing a lot of work around technologies to support older adults during basic activities of daily living and self-care activities. So we've produced smart home systems that are out there that can provide reminders and prompts to older people with dementia for them to complete their activities more independently. And these are just not like buzzers that go off, but ones that use things like artificial intelligence that learn about the person and adapt to the person. So there's that kind of level of continuity between how a family caregiver may work with them and the technology. As you saw an example of technologies to help with diagnosis and prediction of older adults who may get dementia or whose dementia may progress, and we want to make sure we put right interventions into place. And then there's a whole host of very simple technologies that work great with people with dementia. And again, those may be things like, you know, simple or remote controls for television, simple telephones that they can use, things that help with memory reminiscence therapy, for example, that show them pictures from their childhood, music therapy. Again, my mind is drawing a blank right now, but there was that documentary out there about music therapy with people with dementia. And if you kind of, again, Google it, you'll find it. But there's this classic scene in it where there's a gentleman with dementia, totally unresponsive, just sitting there, and a song is put on, and all of a sudden he brightens up, gets up, and he's dancing. First time in years, right? Powerful, powerful moment of showing how very simple technology can be used with people with dementia. But the last thing I'll just close off saying is there's no one fit all solution here, right? There's no magic bullet that's going to solve the case for every older person, whether you have dementia or not. It's going to, you know, take some assessment. It's going to take understanding of what that person needs. And that's where, you know, it's important to get the family, the caregivers, the clinical team all involved in making these decisions in terms of what types of technologies can be used. And yes, Alexa does give reminders, lists, things like that for family. And in fact, Amazon is getting into this business. They are developing technologies for older adults. Amazon a few years ago hired the foremost geriatrician in the United States to head up their special projects division, which is essentially, I think, everything we're talking about here.
Great. Thank you all. So on behalf of Vaughan Public Libraries, I would again like to thank Dr. Mihalidis for joining us tonight. And thanks to all of you for taking the time to participate in this lecture. Our next theme in our lecture series will be immigration, and the first session will be conversations on social inclusion, newcomers and Canadian society, and it's going to be presented by Dr. Howard Ramos. So the registration, I think, will be in the chat, and hope you can join us for the next series of lectures. Thank you all for coming out tonight, and have a good evening.